Hello, everyone. Thank you so much for joining me today at another live stream presentation. My name is Melissa Favela, and I'm the community educator for Southern Caregiver Resource Center, where our mission is caring for those who care for others. I would invite you to get comfortable if you can, or maybe even grab a notepad pen to take down notes if you're able to. Otherwise, I'm glad to have you here with us today. We will be presenting on caregiving through vascular dementia. And so, without further ado, let's get started with those learning objectives for today. We will hopefully get a better understanding of what vascular dementia is, understand the difference between vascular dementia and Alzheimer's disease because they might be similar. They are types of dementia, and hopefully we have that very clear, the similarities and the differences. And also some recommendations as to how to reduce the risk of vascular dementia. Next slide, please. So as always, we like to start with some statistics. We know that it is important to understand and learn what vascular dementia is. And we, of course, will be talking about that. But there is also a very important part about understanding the numbers of the impact that vascular dementia has, not just on a national level, but also on a local level. So here you'll see some statistics on these. And out of all of the dementia diagnoses, approximately 5 to 10% of the people diagnosed with vascular dementia have it on its own. However, most vascular dementia is part of what we call mixed dementia. So when there are other types of dementia present as well. This means that it's found along with Alzheimer's or Alzheimer's and Lewy body dementia, etc. It is thought that vascular dementia and mixed dementia is severely underdiagnosed, even though it's considered very common. There currently isn't a great way to measure the different types of dementia that a person might be living with. And at this point, the best system in place is longitudinal studies, looking at the symptoms, and then starting autopsy reports after they pass away. I mentioned all of this before I go into the San Diego specific statistics because they are grouped in people living with Alzheimer's disease and non-Alzheimer's related dementias. Now, just this year in May, the County of San Diego published a fact sheet on older adults living with Alzheimer's disease and non-Alzheimer's related dementias. This publication states that in 2022, approximately 49,000 to 53,000 individuals that were 65 and older were living with Alzheimer's disease or non-Alzheimer's dementia in San Diego County. There is also a projection for 2050 that states that there could be as many as 76,000 to 90,000 individuals in the county living with Alzheimer's disease or non-Alzheimer's dementia. This publication also has other projections for 2050. One of them is that female population who is 65 and older will have the greatest projected increase in living with Alzheimer's dementia and non-Alzheimer's dementia. And a second projection that they have is that the Hispanic population has the greatest projected increase in people living with dementia. Now, when it comes to caregiving, we also always want to consider those caregivers who are caring for someone who has vascular dementia. In the same year, in 2022, there were an estimated 90,000 to 100,000 unpaid caregivers of people with Alzheimer's disease or non-Alzheimer's dementia in San Diego County. This translates to approximately 128 to 138 million hours of unpaid care, which has the monetary value of $3 to $3.3 billion. We can only assume that because the number of people with Alzheimer's disease or non-Alzheimer's dementia diagnoses will increase by 2050, the number of unpaid caregivers or family caregivers will also increase, thus showing an increase in hours of unpaid care and its reflection in monetary value. So again, we know that it is that the labor family caregivers do and have in their day-to-day is not just their efforts, their mental health, their physical health, but also that monetary value that really they're doing for free. And so again, that's why we like to mention these statistics to maybe give you a different perspective as to why we're talking about these topics and family caregivers. Next slide, please. So what is vascular dementia? The National Institute on Aging states that vascular dementia refers to changes to memory, thinking, and behavior resulting from conditions that affect the blood vessels in the brain. Cognition and brain function can be significantly affected by the size, location, and number of vascular changes. Vascular dementia is the second most common dementia diagnosis after Alzheimer's disease and can occur, as we said, alone or alongside other forms of dementia. Next slide, please. So what does vascular dementia look like? Again, it can occur alone or part of a different diagnosis, but when an individual is diagnosed with vascular dementia, their symptoms can be very similar to the symptoms of Alzheimer's disease. These symptoms can begin gradually or can occur suddenly and then progress over time, with sometimes possible short periods of improvement. So these are just some of the symptoms that people with vascular dementia may experience. It could be difficulty performing tasks that used to be easy, such as paying bills, or they're having trouble following instructions or learning new information and routines, forgetting current or past events, misplacing items, getting lost on familiar routes, problems with language, such as finding the right word or using the wrong word, changes in sleep patterns, difficulty reading and writing, loss of interest in things or people, changes in personality, behavior, and mood, such as depression, agitation, and anger, having hallucinations or delusions, and having poor judgment and loss of ability to perceive danger. So if you are familiar with some of the symptoms that people diagnosed with Alzheimer's disease have, you'll notice that these are very similar to each other. So again, they may be very similar, but with vascular dementia, these symptoms can occur suddenly. Next slide, please. So here you see a little image that has kind of what we want to reflect on Alzheimer's and vascular dementia, right? They are different, but they do overlap. But here are some few key differences between both. The cause of Alzheimer's and vascular dementia are different to each other, and we'll explore that in the upcoming slides. The potency and progression of the symptoms may differ, even though the symptoms are very similar, and the treatment is different. Vascular dementia treatment might focus on cardiovascular health, while Alzheimer's disease might focus on cognitive symptoms. So again, we will explore these in the upcoming slides. Now, as a reminder, vascular dementia is caused by different conditions that interrupt the blood flow to the brain and the oxygen supply to the brain, and this damages the blood vessels that are in the brain. Now, these abnormalities can include evidence of prior strokes, which are often small and sometimes they don't cause any symptoms. But then we have major strokes, and major strokes can increase the risk for dementia, but not everyone who has had a stroke will develop dementia. Now, research has shown a strong link between cardiovascular disease involving the heart and blood vessels and cerebrovascular disease involving the brain, and all of that involving dementia. Now, this area of research, if you're interested in learning more, is referred to as vascular contributions to cognitive impairment and dementia, or VCID for short. It is helping researchers better understand this connection and whether the methods used to prevent and treat this disease and heart disease could also help prevent dementia. Now, these researchers who are investigating VCID are exploring diverse conditions that affect blood flow to and within the brain, including infarcts, an area of dead tissue resulting from lack of blood supply, hemorrhages, cerebral hyperperfusion, and small vessel disease in the brain, such as that thought to be associated with white matter hyperintensities, and of course, stroke. So if this is of interest to you, remember it is VCID and it is a focus area of research. Next slide, please. Now, to diagnose vascular dementia, a doctor may ask about problems with daily activities. They will most likely conduct memory or thinking tests and speak with someone who knows the person well to see if symptoms of dementia are present. Medical history, lifestyle, and brain imaging tests are often used to help determine whether vascular dementia is the cause of symptoms. Now, people with vascular dementia almost always have abnormalities in the brain, and that can be seen on an MRI scan. It can be small blood vessels or changes in white matter that are shown in those MRIs. Now, researchers are investigating how these changes in the brain are involved in the onset and progression of dementia. So again, it's not necessarily one test that will be the diagnosis or that will give us the diagnosis of vascular dementia, but a little bit of a mix of tests and screenings that the doctor will have to do. Next slide, please. Now, as for treatment, well, because many different disease processes can result in different forms of vascular dementia, there may not be one treatment for all. Now, treatment for vascular dementia focuses on preventing future strokes. However, vascular dementia is often managed with medications to prevent strokes and to hopefully reduce the risk of additional brain damage. They can be medications like blood thinners. However, because we need to know or understand the underlying cause that caused the stroke and subsequent vascular dementia, we need to treat that underlying cause first. Now, some studies suggest that medications that are used to treat Alzheimer's might benefit some people with an early form of vascular dementia. Treating modifiable risk factors like high blood pressure, diabetes, high cholesterol, and problems with the rhythm of the heartbeat can help prevent additional strokes. All of this to say that any conditions related to your cardiovascular system are important to manage and keep that cardiovascular system as healthy as possible to hopefully prevent the risk of stroke and thus prevent the risk of vascular dementia. Now, living a healthy lifestyle is important. So it's not that we just want to focus on managing just our high blood pressure or just our blood glucose levels. It's all part of that healthier lifestyle as much as we can, right? And so all of this to hopefully reduce that risk of vascular dementia. All of this being said, there is currently no treatment available to reverse brain damage that has been caused by a stroke. Next slide, please. So how are we going to reduce the risk? Well, we already mentioned part of it, right? Making sure that we're managing those cardiovascular health conditions or cardiovascular markers, such as managing our blood pressure, cholesterol, blood glucose. It is very common that if someone has high blood pressure and it's unmanaged or it's not diagnosed as high blood pressure, then most likely they will start having issues with high cholesterol and high blood glucose, which can lead to diabetes. And so if one of these isn't doing great, most likely the other two aren't doing great either. And if we're having issues with all three is what we would call metabolic syndrome. And so this happens when, let's say, we don't know that we have issues with cholesterol, let's say, and it goes undiagnosed. And so that's why it's very important to have our health screenings, our visit to the doctor at least once a year. But if we see that we do have an issue, or if our doctor communicates that there is an issue with, let's say, our cholesterol, well, then maybe they'll want to see us more often than just once a year. So again, it is very important to screen ourselves, have that early detection to help manage these markers for our cardiovascular health. Now, another way to reduce the risk is to avoid smoking and drinking alcohol as much as possible. If you know that you already have high blood pressure, then it is definitely a recommendation to stop smoking or not start smoking, and try to avoid alcohol, because some of these can exacerbate our blood pressure, our cholesterol, our blood glucose if we already have a diagnosis. So avoid smoking and drinking alcohol in general. Maintain a healthy weight. This is going to be different for everybody. And really, a healthy weight is not just that number on the scale, but it is how we feel on a day-to-day basis. How much are we moving? Do we have a sedentary lifestyle, right? So making sure that we're reducing how sedentary we are, that we're moving more, that we are more that we're more active throughout our day. And of course, this is related to dementia, right? Or prevention of dementia, is to practice cognitive stimulating activities, which can be lots of different things, right? It could be as simple as crossword puzzles, or it could be as specific as something the doctor might suggest in case there is already a diagnosis or there's a risk of a stroke. So making sure that we are being proactive to reducing the risk. Now, this is by no means a complete list. So if this is of interest to you, if you think you are at risk, if maybe you haven't had your annual health screening, make sure that you talk to your doctor, maybe set an appointment, make sure that you ask those questions to help you reduce the risk of vascular dementia. Next slide, please. Let's talk a little bit more about research and vascular dementia. I mentioned earlier that there really isn't a great way of necessarily keeping track from one day to the next. It's more of a longitudinal study that can benefit maybe the design of new drugs that might help manage dementia, or understand the progression of the symptoms. I also mentioned other studies that are happening with vascular health and dementia. And so you might have gotten the idea that research is a very important part of how we understand and how we treat vascular dementia. And so this is why we have this specific slide, then onto how a person with vascular dementia can help others via research. And you can do this by volunteering for a clinical study or clinical trial. You can become a partner in helping researchers discover new ways to potentially diagnose, treat, and prevent Alzheimer's disease and related dementias. You may or may not, depending on the study, receive medical care and new treatments that are not yet available otherwise. Learn about the disease and your medical condition in more detail and very specific to you. Gain access to resources such as educational materials and support groups, and help provide others with better treatments and prevention strategies in the future. Now, here in San Diego, there are very prestigious institutions such as UC San Diego that are doing a lot of research into dementia. So, or if you are not in San Diego, if you are somewhere else, you can also go onto the Alzheimer's.gov website or a DRC website and plug in your zip code and see if there's anything near you where you might be able to participate or participate at a distance. Now, research involving people is called clinical research. And there are two types of clinical research studies. We have observational studies and clinical trials. So I'm just going a little bit into what you might be looking into if you do decide to participate in research. So focusing on observational studies, these are designed to collect information from people and compare that data over time. This helps them learn how different behaviors or lifestyles relate to health and disease, and to understand how disease progresses over time. Then we have clinical trials. These are a type of research that tests new drugs, medical devices, surgical procedures, or behavior and lifestyle changes such as exercise. Now, clinical trials may also test ways to detect and diagnose diseases and to better care for those living with those diseases. Now, researchers will determine if what is being tested, called an intervention, is safe and effective by comparing results in the test group to those in the control group. So again, this is a very brief overview as to what type of research you might take part of and where you can find space to participate in a research study. And also, hopefully, you do understand that participating in research will not cure necessarily vascular dementia in yourself or your loved one, but you are helping future generations hopefully find a treatment sometime in the future. So again, lots of research going on around vascular dementia. Next slide, please. Now, let's go back to a person that is living with vascular dementia. Of course, living with it is challenging, right? On multiple levels, multiple aspects of life, of self, etc. They might come to terms that vascular dementia is a progressive condition, and this is something that the family also has to come to terms to, meaning that individual, and their caregivers have to figure out what life is going to look like in the future and how they're going to adapt to those changes. Now, I'm going to talk about some strategies to help individuals living with vascular dementia, how to maybe give some ideas on how they can adapt to the challenges that they face on their daily lives. And so, of course, this is by no means a complete list, but maybe it is, they are some recommendations that might help you and your loved one. So the first recommendation is to create a routine, making sure that we have a regular routine that we can always kind of go back to, that provides structure, that is predictable in the day. This can be especially helpful for people who have difficulty with memory and thinking. And so this can help them feel more in control, more independent. They are less nervous of the unknown. And so really making sure that we're creating a routine, and a routine that we can fall back on is always a good idea. The next one would be using memory aids and reminders. And memory aids can be different. Maybe if we start using one memory aid that works well, it doesn't mean that it's going to work well all of the time. We might have to adapt in the future. We might have to adapt day to day. But this can be, as an example, using a calendar, having a pill organizer with the days of the week, having to-do lists, making sure that we're setting alarms maybe, using a calendar to help us and our loved ones stay on track, etc. So again, we can be as creative as possible with memory aids. Additionally, we can also ask for help. Patients should not be afraid to ask for help from, family, friends, and professionals, of course. There are a number of resources available to help patients with vascular dementia, such as support groups, home care services, etc. And this is really where Southern Caregiver Resource Center can help family caregivers who are trying to figure out how and where to ask for help. And we can also suggest engaging in cognitive exercises and activities. These can help slow the progression of vascular dementia and improve cognitive function. Again, I mentioned them briefly, but they might include playing games, doing puzzles, reading, etc. And the very last one is navigating complex emotions. Maybe this is not the first thing that comes to our mind when we think about managing and coping with vascular dementia, but it is important that people who have this diagnosis find coping strategies that work for them. There is, of course, no one-size-fits-all approach, and what works for one person may not work for the next person. It is important to have a lot of patience with the person living with vascular dementia and with ourselves as caregivers, and they themselves with being the individual who are living with this type of dementia. Don't get discouraged. It's not something where we see results immediately, but with the right support, with the right guidance, patients and the families of those living with vascular dementia can live very meaningful lives. So again, making sure that we are not just acknowledging, but also learning how to navigate and deal with these complex emotions that can come up with a diagnosis such as this. Next slide, please. So switching gears a little bit, how can caregivers help their care receivers maintain independence, their dignity, and of course, helping them stay safe with their day-to-day activities? Well, thankfully, there are adaptive devices and adaptive equipment, and these will be crucial tools to not take over what the care receiver needs to do, but help them maintain their independence for longer. So we are using these tools to help them adapt to their environment as they need help, and also to protect the caregiver, right? Because if the caregiver wants to do everything to help their care receiver without any assistive devices, it might take a toll on the caregiver. They might become injured. And so really all of the devices that you see here on this slide can really help not just the care receiver, but the caregiver as well. So again, this is not a complete list, but these are some of the most popular ones. So grab bars, I think we've all heard of grab bars, how they can be installed pretty much anywhere as long as they are well placed and safely installed. Non-slip mats, very important to avoid falls and tripping. Adequate lighting, same thing, to make sure that let's say like the hallway is visible, that if there is a carpet there, that we know where the carpet starts, where it ends, hopefully to avoid accidents. Having raised toilet seats. If we are having, if our loved one is having issues with mobility, full mobility, having that raised toilet seat can really help them avoid further injury, and of course the caregiver as well. Making sure that we have maybe a shower chair to make shower time easier for everyone involved. Walking aids, specially designed kitchen utensils, automatic shut-off appliances, medication monitoring, and for people who have dementia and possibly advanced dementia, there are even eating utensils that are friendlier for them to use. So again, sometimes we don't know about these things. It's not that we don't want to use them, it's that maybe we don't know that they exist. So maybe this is something that if you are thinking you might benefit from as a caregiver with your care receiver, please look into it, because it is a way to help them, again, maintain their independence for as long as possible, but also help you as a caregiver help them and help you avoid injury. Now, as I said, these assistive devices might not be needed initially when there is a diagnosis, but they might be needed in the future. So again, just knowing about them is very important. If you are wondering if this is covered by your insurance or your loved one's insurance, make sure that you are asking the doctor, that everything is getting charted so that the insurance company knows that it is needed or suggested. Additionally, if you're not covered for whatever reason, there are organizations in San Diego County that might be able to help purchase these, or for example, install grab bars in your loved one's home, etc. So again, making sure that these are resources that you know about. Next slide, please. And of course, caregiving, right? We know that caring for someone can be a challenging yet rewarding experience. And so it is important to recognize and address that caregiving has such a big emotional impact on caregivers, not just their care receivers, and the family in general, right? Those that surround the caregiver. Caregivers may experience feelings of grief, anger, guilt, frustration. Guilt is the big one, feeling that we're not doing enough. And it is important for caregivers to recognize these emotions and to seek support if needed. Support can come outside of those friends and family members. That family caregiver may need professional support, maybe a counselor, maybe a support group, but making sure that we are seeking support if we feel like we need it. Caregivers also play a vital role in helping their care receivers learn and adjust to new safe environments. And of course, this would include using those assistive devices, which we discussed in the previous slide. And some individuals with vascular dementia may have struggles with communication, and caregivers can learn new communication strategies and help the care receivers adapt to these. This can include speaking slowly, clearly, using very simple language, avoid distractions when communicating, just one topic at a time, allowing enough time for communication to flow. And caregivers can also ask their care receivers for feedback to make sure that the message was not just received, but also understood. Of course, with dementia, that can be more challenging. But again, it is important to kind of put it in our routine, having those communication strategies be part of our routine. The importance of self-care is also top tier with SCRC. When we talk about it, is one of the most important things. However, when it comes to actual caregivers practicing self-care, a lot of the times that's the last thing that they want to do, the last thing that they do, right? It's always, the focus is always on the care receiver. But caregivers need to take care of themselves in order to be effective caregivers. This might include getting enough sleep, eating nutritious foods, exercising regularly. Caregivers should also find the time, and this is where it gets more challenging, to do activities that they enjoy, that they really help the caregiver relax, that they give the caregiver that sense of purpose to keep going, to keep motivation going. So making sure that we are trying to have those activities that give us that joy, those things that we really enjoy doing. As simple as they might be, or as complex as they might be, trying to fit those into the caregiver's schedule. And of course, building a support system for the caregiver and not just the care receiver. This can include help with practical tasks, but also emotional support. As caregiving and as a caregiver, you know that there are those moments where you get to celebrate those small victories, right? Those small moments of connection. And so making sure that we can turn these moments into a moment of hope and strength and motivation to keep us going as caregivers. Next slide, please. Now, again, caring for someone, very rewarding, but also very stressful at times. And with vascular dementia, we know that it is a progressive disease, especially if it's not managed very well. It is a long-term challenge, right? It is a long-term caregiving responsibility. And so this can have that stress compounding over years and years, if not decades, right? And so it is very disheartening when there's no hope that the family member will get better. despite the caregiver's best efforts, despite all of the things that they do, the condition will gradually deteriorate. So if the caregiver, those surrounding the care receiver, don't get the physical and emotional support that they need, the stress of caregiving can really leave them vulnerable to a wide range of problems, including, of course, depression, anxiety, burnout. And when caregivers get to that point, everybody suffers, right? Not just the caregiver, but also the care receiver. So that's why making sure that we are managing the stress levels in your life is just as important as making sure your family member gets to their doctor appointment, that they take their medication on time. So here are just some warning signs that as a caregiver, you should also seek help. That feeling of constant stress, that feeling of being isolated, of feeling that you are alone in this, that there is no one else that you can talk to or that you can connect with. Having the maybe some health issues that exist and having them be worse, right? Because maybe that caregiver is missing their doctor's appointments, or maybe the caregiver is starting to have mobility issues, right? Maybe they stopped exercising, they stopped eating well, they stopped resting. And so it's not just the care receiver having issues, but also the caregiver. And of course, the care receiver safety incidents. A lot of the times our caregivers are so exhausted. They are so focused on their care receivers. But even though their best efforts, the care receiver starts having safety incidents, or they stop taking their medications as they're supposed to because the caregiver is so tired, right? They're burnt out. They are missing things, right? They were so focused on the care that now the caregiver is missing things. And this doesn't make the caregiver a bad caregiver. It just makes them a tired caregiver. And so again, that's why it's so important that if the caregiver is doing well, most likely their care receiver will also be doing well. Next slide, please. And so it is important to understand that as a caregiver, there are supportive services available for you. There are many different types of support groups. The Southern Caregiver Resource Center has support groups. Other organizations have different types of support groups. There's also individual counseling, which Southern Caregiver Resource Center also provides for free. You can engage in enjoyable activities. You can enjoy them with maybe other caregivers or with friends and family. And of course, do not underestimate the power of rest and nourishment. And so making sure that as a caregiver, you are reaching out for support. That is key in every caregiver's journey, not just for those caring for someone with vascular dementia, but any caregiver, if it's long-term, if it's short-term, if it's temporary. Every caregiver has stressors. So making sure that you are seeking support from those around you or from professionals, there is no shame in that. It is something necessary. So caregiving is already difficult enough. So don't make things more difficult for yourselves. Make sure that you ask for help, that you ask for support. And by asking, you will most likely get some type of support, right? But if you don't ask, nobody knows that you might need help. So again, as caregivers, things are already difficult enough. So moving on to our next slide is where I want to tell you about all the different supportive services that Southern Caregiver Resource Center offers family caregivers for free. And so one of those services is making sure that family caregivers are paired up with the family consultant, and that family consultant can help the caregiver set up basically a caregiver plan, making sure that they know about resources available to them, not just within SCRC, but also outside, maybe with the county. And so making sure that we have that connection with the family consultant. Also support groups, making sure that caregivers know that SCRC offers support groups in person, online, in English and Spanish. Also individual counseling as well. We also have legal and financial consultation available for family caregivers. A lot of education, our TLC and Calma program, and of course our respite program. So here you'll see the Family Caregiver TLC is our evidence-based educational program. And if this is of interest to you, this is specific for those caregivers who are caring for someone who has memory loss, Alzheimer's, or another form of dementia. So if this is of interest to you, please reach out. We also have a lot of information in our iCare portal, and this is our available online. If you go to the next slide, please. And one more. Thank you. If you go to our iCare portal, this is where you can find a lot of the information that we have online. We have our Caregiver Corner, which are quick tip videos. We have a podcast called Let's Talk Caregiving. We have a lot of other classes available through our YouTube channel or Facebook. And you can also subscribe to our digital newsletter to stay in touch with us or to have updates as to what SCRC is doing out in the community. Next slide, please. And you can also follow us on our social network. We're in Facebook, Instagram, YouTube, LinkedIn, and Pinterest. If you scan this QR code, it will lead you to a link tree, and there you can choose which platform you'd like to find us in. Next slide, please. And for more information or to access our services or to figure out if you qualify for our services, you can do that via our website, which is www.caregivercenter.org, or you can call us toll free at 800-827-1008 or 858-268-4432. Well, in the meantime, I want to thank you all so much for being here today with another live stream, and feel free to reach out to us if you have any questions or if you want to access the free supportive services that SCRC has. And we'll see you in the next one. Thank you so much.